6th month, your baby is about 11 inches and 500 grams. Rapidly growing in weight, started little blinking, responding to startled sounds. Baby would also have increased fetal activity. You may also have a little aches in the lower abdomen, hearty appetite, constipation, leg cramps, itchy abdomen. A little of mood swings here and there would always be there. And an excitement about the future. What are the issues you may have at this stage and what you can do for them? The most common is urinary incontinence. When you are laughing, coughing, sneezing, you leave little amounts of urine, which may prove very embarrassing. Do Kegels exercise, K-E-G-E-L-S, Kegels exercise for firming up these pelvic floor muscles. These pelvic floor muscles are in the form of a figure of 8, and hence when you contract your urinary bladder muscles, these muscles will become tight. So this pelvic floor muscles should be done daily, 5 or 6 times a day, 10-20 times contractions each time. In the 6th month of pregnancy, varicose veins can now start becoming an issue. You stand for a long period and you get deep turgid veins in your lower limbs. To avoid these, when you're lying down, put your legs up, relax, see to it that you don't walk too much. You can wear pregnancy elastic stockings at night and have a good diet which will prevent too much constipation or prevent fluid accumulation in the lower limbs. Herbal baths, sitz bath will greatly help. Increasing the vitamin E in the diet like sunflower seeds, wheat germ also are great. The next complaint is breast tenderness or lumps. You may have them which may become heavy and tender. Put warm compresses on the breast and do the 4 types of breast exercises. Namely, these are: the first one, you put your hands and contract from the wrist. In the second one, you put the hands out and contract this way. In the third one, you take your arms on top and contract this way. And in the fourth, you go all around like this. So these are the 4 types of breast exercises which will prove very important for toning up the breast. Next, you may get leg cramps at night. They occur because of low calcium, fatigue, and because of compression of blood in the leg vessels. What to do when a cramp strikes? Assuming this is your leg, and normally you get cramps in the calf area, you flex the legs with the toes pointing towards the nose. Keep flexing it many times. Do not do too much massage on the area of the cramp, but do massage in the inguinal area, in the proximal area of the clamp, and a little here in this area of the cramp. To avoid this problem, you can do a little stretches on the wall. For leg cramps in the 6th month, stand near the wall, put both your hands on the wall and press and stretch your calves and go back again. Stretch your calves, pressing and go back again. You can put one leg in front, bend the leg, stretch the leg at the back and go back again. The stretching exercises will greatly help to remove the pressure and the tenderness from the area of the cramp. For leg cramps, it's also a good idea to soak your legs in a bucket of water and put 2 spoons of rock salt and 2 drops of lavender oil in that water. Now for hand numbness. Very often fluid accumulates in your hands and you get a little carpal tunnel syndrome sort of environment. So for such times, when you're sleeping, put separate pillows under your hands and a wrist for your splint. Baby kicks. You may not really notice the baby kicks on a heavy working day. But after a meal, remember that your baby may respond to the sugar which comes from the meal. Also, if you are excited and with the adrenaline getting stimulated, you'll again get baby kicks. Don't bother to compare your kicks with other mothers. Each child, each twin also will kick differently. So just relax.